I'm on hold to my doctor and it's 8:30. There's not enough appointments and I pray I won't be late. The reception staff are wanting to know what is wrong with me. I tell them, but I wish they would respect my privacy. Today I have succeeded at the get appointment race, but a call back from a nurse. I want a GP face to face. I ask when he will call me, but she cannot tell me when, afraid that if I miss his call, I'll have to start again. I'm confused and I am worried by the service I have seen. You can't keep blaming all these things on COVID-19. You should be ashamed about the service you're providing. It seems to me the problem is GPs are all in hiding. GPs will stand along with you. We long to offer more. Access, listening and support is what GPs are for. GP practice challenges are all across the nation. There are solutions. First, I will explain the situation. People living longer with more tablets and conditions, ever more complexity and technical decisions, every week for decades given extra things to do. How our workforce can achieve this now, I do not have a clue. The reason why it feels GPs now hide or do not care, compassion spread so thinly out, can feel that it's not there. The greatest thing in healthcare is to laugh and cry with you. We haven't changed, we're still the same. We miss it just like you. Can GPs and patients face this challenge side by side? We are forced to make adaptations to the service we provide. GP numbers going down, we know they will be missed. There are some new professionals who'll increasingly assist. Alongside nurse practitioners are physiotherapists, physician associates, paramedics and the pharmacists. The options are confusing. How are you supposed to choose? Our reception team are trained to help you know who's best to use. One more consideration is the best way to be seen, telephone or face-to-face, urgent or routine. We can manage far more patients when the phone's where we begin, and if we need to see you, then we simply bring you in. With everyday reception taking several thousand calls, fevers, fractures, fainting, fibroids, geriatric falls, we need to harness all our staff, both phone and face-to-face. To manage all the need, we have to work at quite a pace. Please explain your problem to the team that's on reception. Confidentiality is enforced for all without exception. We'd love to care for patients in the way they all prefer, but many factors are involved in how appointments will occur. It's hard to be a patient in the general practice crisis. These problems were developing before coronavirus. It's hard to cope with changes in the service we're providing. We are aware, we're here, we care, we're definitely not hiding.